Friends, today I am going to elaborate on a subject which is very dear to my heart, and I feel that there has been a loss of learning material resource over the years, and it is a matter of concern for all the pathologists across the globe. Death of autopsy. Many great pathologists of the yesteryears were great proponents of autopsy pathology. Dr. Morgagni published the first comprehensive textbook on pathological anatomy by the name On the Seeds and Causes of Diseases Investigated by Anatomy in 18th century 1769. The two great giants of pathology, Dr. Rokitansky from Vienna and Dr. Rudolf Ludwig Karl Virchow in Berlin. He was also called father of cellular pathology. These two giants are responsible for providing the foundation on which we base our gross and microscopic impressions as to the nature of the pathologic process, respectively. So, the great giants of the past have taught us pathology with the help of autopsy pathology. The past of medical autopsies has been glorious, and present appears to be bleak. Medical autopsy has been the most reliable method of learning clinical medicine and pathologist for the past 200 to 300 years or so. Number of autopsies has, however, steadily declined over the past 40 to 50 years. Today, the medical autopsy has largely been abandoned in most of the medical centers across the globe. Some of the reasons cited for this decline are that the autopsy is time intensive and expensive, and there is increasing pressure to reduce medical costs on all fronts, and expenditure on autopsy cannot be billed to the patient. That is one of the reasons. And availability of high resolution radiology imaging as well as availability of advanced laboratory studies. These have been some of the reasons for the decline in the number of autopsies. Neither the clinicians, nor the pathologist, nor the hospital administrator are interested in performing autopsies these days. However, the reasons to perform an autopsy remain as pertinent and relevant today as they did 50 to 100 years ago. The discovery of AIDS in 1980s is the glaring example of power of autopsy pathology in recent years to increase our knowledge about the disease. Autopsy has been broadly divided into medical and medico-legal. Medical autopsy was carried out in most of the medical institutions about 50 years ago, and this was done in cases which succumbed to disease process during their treatment in the hospital to know the cause of their death. There are now three types of medical autopsies depending upon the extent of examination carried out by the pathologist. Complete autopsy, where the whole body is examined including the brain and all the body cavities. Then restricted autopsy, where only a portion affected is opened up and organs are examined there. And needle only autopsy, where only the needle biopsy is taken from the affected organs. However, we all recognize that Medical autopsies were great source of learning about clinical presentation, behavior, and progress of disease, both for clinicians and pathologists. Medical legal autopsies are carried out in medical legal cases where death occurred due to unnatural causes, and these are conducted by the forensic departments. Now, uh, for people like us of the earlier generation, I completed my MBBS degree in 1969. So in our time, it was the time of autopsies of the patients who died in the hospital. Observation and even participation in an autopsy was a component of postgraduate training in pathology. In our times, the MBBS students were not generally interested in autopsy pathology and they were not invited, but it was mandatory for all postgraduates to attend the autopsy discussion and autopsy procedure. After the workup of the autopsy by the pathology department, there was organization of clinico-pathological meetings, and these meetings used to be great events where clinical stalwarts and pathology giants used to discuss clinical findings and course of the disease and correlate their pathology findings. Since these meetings were very important part of training, these had heavy presence of faculty and trainees of clinical and pathology departments. In difficult cases, long discussions usually led to recognition of new entities and syndromes. Here we can see a clinical pathology meeting in progress. The organs retrieved from the autopsy were priceless acquisition of pathology departments, and these were mounted in glass jars to decorate the museum and were used for learning of gross appearance of diseased organs and were a tool for MBBS and postgraduate teaching. The organs unaffected by disease from autopsies were used for teaching of gross anatomy of organs in anatomy departments. People not only gave pearls of wisdom while living, they laid down their open bodies for people desirous of learning after their death also. When decline in the number of autopsies started is difficult to answer, as I said earlier also, but after 1950s and 60s, gradually the number of autopsies performed all over the country reduced tremendously. Clear-cut reasons were not apparent, but the decline, as discussed, was multifactorial, including refusal of the patient's relative for autopsy, declining desire as well as need felt by the clinician due to rapid advances in diagnostic branches of radiology, pathology, immunology, microbiology, serology, and others, which were used to establish the clinical diagnosis. Some institutions continued with partial autopsy, where only involved organs were removed for pathological study. Today, most of the institutions in India, barring a few, do not carry out autopsies. It seems that medical profession as a whole perceives the autopsy as no longer useful, and this is unfortunate. That it has a detrimental effect on pathology training. The decline has affected pathology training adversely as vital organs like heart, brain, lungs, liver, etc. are not available for teaching. A student can never hope to see a specimen of myocardial infarction, which is a leading cause of death all over the world. Situation has been compounded by practice of non-invasive or minimal invasive surgery and neoadjuvant chemotherapy as The resection of diseased organ is no longer carried out, and this has been replaced by needle or core biopsies. It is not clear how this loss of mine of learning material can be compensated, but newer approaches like plasticization of the organs and 3D images will have to be developed by teaching pathology departments. Work in this direction has already started in some colleges. And with that, with a heavy heart, I say thank you to all at the gradual death of autopsy. Thank you very much.